What is hemorrhagic stroke risk when taking blood thinners? Have you ever wondered about the connection between blood thinners and the risk of hemorrhagic stroke? Blood thinners, also known as anticoagulants, are medications that help prevent blood clots. While they are crucial for preventing ischemic strokes, which occur due to blood clots, they can also increase the risk of hemorrhagic strokes. This type of stroke happens when a blood vessel in the brain ruptures, leading to bleeding. The deadliest type of stroke, hemorrhagic stroke, can be more severe when blood thinners are involved. These medications reduce the blood's ability to clot, making it easier for bleeding to occur or worsen if it does. Research indicates that about 20% of patients who experience brain hemorrhages have been taking anticoagulants, highlighting a significant link between these medications and hemorrhagic stroke risk. Different blood thinners carry varying levels of risk. Traditional anticoagulants like warfarin have been associated with increased chances of both intracerebral hemorrhage, which is bleeding within the brain tissue, and subarachnoid hemorrhage, which occurs in the space surrounding the brain. On the other hand, newer oral anticoagulants, such as rivaroxaban, apixaban, and dabigatran, generally have a lower risk of causing intracranial bleeding compared to warfarin, but they still present some risk. Several factors can influence the risk of hemorrhagic stroke while taking blood thinners. The duration of use is one important factor. The highest risk of intracerebral hemorrhage often occurs shortly after starting warfarin, likely due to challenges in maintaining stable anticoagulation levels. Additionally, certain medications and supplements can interact with blood thinners, increasing the risk of bleeding. For instance, drugs like amiodarone and fluconazole, as well as high doses of turmeric, can heighten this risk. Patient-specific factors also play a role. Age, high blood pressure, and other vascular risk factors can elevate the risk of hemorrhagic stroke during anticoagulation therapy. Despite these concerns, blood thinners are vital for stroke prevention in many patients, as they significantly lower the chances of ischemic stroke recurrence. Recent advancements have introduced reversal agents, such as idarucizumab for dabigatran and andexanet alpha for rivaroxaban and apixaban. These agents can quickly counteract anticoagulation in emergencies like brain hemorrhages, improving survival outcomes. Clinical studies suggest that starting blood thinners soon after an ischemic stroke, typically within days, can safely reduce the risk of another stroke without significantly increasing the risk of hemorrhagic stroke. This emphasizes the importance of careful timing and individualized management in stroke prevention. In conclusion, while blood thinners do increase the risk of hemorrhagic stroke by impairing clot formation, their benefits in preventing ischemic strokes usually outweigh these risks when used correctly under medical supervision. Regular monitoring, awareness of drug interactions, and prompt treatment for bleeding complications are essential for managing this risk. Always consult your healthcare provider for personalized advice regarding blood thinner use and stroke prevention.